All right, so welcome to my little discussion on chronic pain and sleep. The information provided here was from Connie Zhao, who is a certified traditional Chinese medicine doctor, and also Maria de Ramu, who is a physical therapist. So, when you are suffering from pain, you may or may not be suffering from depression concurrently. Depression can lead to fatigue, which leads to sleep, which leads to more depression. So often, when you're suffering from pain, you also sleep poorly because your sleep is being disturbed by the pain. So, but every patient with chronic widespread pain requires evaluation of their sleep. Poor sleep and depression are independently associated with pain. So, did your poor sleep cause you eventually to develop chronic pain, or uh, is your pain preventing you from sleeping? So, they're very much linked that way. The different types of sleep issues are difficulty falling asleep, trouble staying asleep, hard time getting back to sleep. Sleep can be disrupted by your chronic pain as well as other issues. So often, people don't really, not that they don't understand how they sleep, but they might say, hey, I sleep fine. Once you start asking a few questions, do you feel rested during the day? Usually, sometimes they'll say, no, I never feel rested. I have felt this way for X amount of years. Objective source of how their sleep is. So they don't realize that they're sleeping badly. They're just kind of like, since this is the norm for them, they think this is how it should be. Sleep monitoring is extremely helpful. So sleep monitoring could be the sleep studies that we provide at Clinic SomnoMed, or even something as like a Fitbit, where it's long-term sleep monitoring over a couple of days, week, months. This is a really good assessment on how your sleep is throughout this longer period of time. Great information to give to your family physician and or your sleep doctor to assess if you have any issues, mainly, of the insomnia variety. We have 4 sleep cycles, so this is a normal sleep. So good sleep looks like this. So if you look at the green circles, this is REM sleep. When we look at the red circles, that's slow wave sleep. If we look at them together, we have a red, a green, red, green, red, green, red, green. We want those chunks to be looking pretty much like we see them here. On average, they last about 90 seconds each, and you have 4 cycles of sleep. Here is a sleep hypnogram. If we those green circles are now those red bars, that we missed the slow wave sleep section in the beginning, which is the N3. And we have kind of like broken up sleep due to all those little green, those green checks on top. If you look at this person's sleep, we see completely missing their first REM period, which again, not completely abnormal in a sleep study. But we only see 2 cycles of REM sleep. So this person's sleep is pretty fragmented and doesn't look like a normal sleep hypnogram. So some sleep tips for you would be to keep a consistent sleep and wake time. Give yourself enough time to sleep. Establish relaxing. So sleep disorders can include sleep apnea. So here Homer does, I would think, suffer from sleep apnea. Falls asleep while reading a book in the daytime should not be something that, that happens. Sleep apnea can also, one of the symptoms could be also insomnia. So you have insomnia because you're not sleeping well during the night. Some of the symptoms that some people have would be sleep deprivation, poor concentration, poor memory, anxiety, snoring, and waking. So, common complaints that might be stated to the doctor would be, you wake up during the night to pee, you can't fall back to sleep, there's general discomfort, you wake up, you don't feel well, headache, sleep hallucination, paralysis. These are maybe the first thing you might say to your doctor versus saying, I think I have sleep apnea. So, insomnia definitely can be caused by a sleep disorder. Sleep tests like the following: a polysomnography that looks at your brain waves, eye movements, chin movements, heart activity, abdominal and thorax, oxygen rate, this and your leg movements. This is a complete test to look at your sleep fully. And it gives us an assessment as to whether you're sleeping well or not and what we can do with that afterwards. So sleep fills up your energy for the day. So if you're sleeping well, you have the amount of energy you need to get on with your day. However, if you have pain that's taking from your sap of energy, it's sapping from your energy. You have fatigue, same thing, it's from that well. Emotional stress and work also take from that amount of energy that you have. So if you're not sleeping well and you don't have the amount of energy you need to get through a normal day, and you have all these other stressors in your life, it's no wonder that people fall under depression. So treatments for pain can include exercise, physical therapy, massage, acupuncture, and traditional Chinese medicine. So one of the reasons people might choose traditional Chinese medicine is there's less side effects. They've tried traditional drug therapies and that just hasn't worked for them. Recommendation by someone who's gone through the same experience. Chronic diseases can be successfully treated. Insomnia, there's cases of insomnia being treated really well, and pain as well. Some of the treatment methods include acupuncture, cupping, and acupressure. So others include herbs, healthy dieting, healthy lifestyle, and physical exercise, and a combination of those. So when we look at insomnia, there was this case of someone treated with traditional Chinese medicine of a 6-year-old woman who suffered from insomnia for over 6 months. It was hard for her to fall asleep, and she woke up. So after cupping treatment 2 times with 3 weeks of herbs, the patient was recovered from insomnia. Now, we don't have information from a sleep study to say, hey, what was the issue beforehand? But it is great to see that someone has an option to treat the issues that they're having. So types of insomnia that we see would be insomnia of at least 3 nights. Primary insomnia, which is distinct from a symptom, a distinct entity from a symptom, so not necessarily dealing with sleep apnea, and psychophysiologic insomnia, so sleep preventing associations. So that last one is not necessarily easy to treat, but it's not necessarily treated with the standard that you have out there for sleep apnea. Duration of insomnia could be acute or chronic. So in regards to that last physiologic insomnia, the role of thinking. So this is maybe very lightly based on CBT. It's not necessarily, all of it is a very kind of small snippet. If you're sleeping poorly due to stress, pain, or that can lead to negative thought, like if I don't sleep well, I won't do well at work tomorrow. What am I going to do? That and eventually associating the area where you're trying to sleep with the fact that you can't sleep. You continue not to be able to sleep. So you're in this kind of like cycle of poor sleep and no sleep. And if this is due to the pain that you're suffering or stress in your life, this can lead to chronic insomnia if left. Sleep definitely is important, and I think most people understand that it's important. And it's definitely one of those aspects of overall health. So if you don't sleep well, it can affect your immune system, and it can lead to changes in your blood chemistry and can lead to diseases over time like heart disease and diabetes. So foundations for good health, as stated here, are good diet, good exercise, and good sleep. So if you're suffering from pain that's untreated, that's something that you'll definitely need to get checked out. So that's honestly a very little quick link of why it's important to treat your chronic pain and why also it's important to treat your sleep in order to help your chronic pain, because they play on each other. So if you do have any questions, please contact us at Clinic Somnomed. We are here to help you. We're here to kind of direct you where you need to be. And obviously, for any sleep testing needs that you may have, we're here to get that done for you as quickly as possible. Thank you.